Hi, I'm Dr. Stephen Clayman, chiropractor. The history of kinesiology is quite interesting. Back when two medical doctors wrote a book, their names were Kendall and Kendall, on muscle testing, it became common knowledge that you could determine the damage done to a muscle by a test. So if you wanted to suspect that there was damage to a bicep, you could test the patient, test this bicep, and then you could test this bicep. If they couldn't hold one, you knew that that one was weaker and that there was probably some damage to it. And you can do that with any pairs of muscles, whether it's the quadriceps, whether it's the triceps, etc., etc. Out of that knowledge from Kendall and Kendall, George Goodheart took the theory that when you were very little, maybe this big, before you had a spinal cord, you had a notochord. The notochord contained connections between nerves that led to muscles and organs. And then that connection stayed the same as you got bigger, and then you became a full-blown fetus, and then you were born. By that time, the spinal cord was maybe that big. But the connection stayed as the muscles and the organs migrated and grew in size. Then you came out, you became a child, you became an adult, and the same connections maintain, but the organs have moved further away from the spine. He reasoned that because the nerves innervated the organ and muscle, if there was damage to a muscle, there was probably some damage to that same organ on that same side. So for instance, if we look at the spine, or if we were to look at a cadaver, we would know that the T9 thoracic nerve root leads to the adrenal gland on that side and the sartorius muscle. So the sartorius muscle allows us to do this action. Extend the leg out to the side. If one of those are weaker, it's suspected that there's probably some weakness in that adrenal gland on that side. So Goodheart figured out ways to strengthen that sartorius muscle, not with exercise, but with treatment or with nutrition. So maybe he would rub some neurovascular points or give some sort of a food or a supplement. And if that strengthened up the sartorius muscle, he would expect the patient to have more energy because the adrenal gland was starting to function better. And in fact, that's what happened. And out of that came the whole field of applied kinesiology, which is a whole methodology for treating people in a drugless manner to get to the cause of the difficulty and fix the problem at the root. But when we studied that, the treatment and the testing was very laborious, very time-consuming, and wasn't really that much fun. One of Goodhart's disciples was Dr. Viktor Frankl. He and some other chiropractors and some naturopaths devised a system where instead of touching or testing all individual muscles, you could touch a reflex point on the body and test one muscle. So maybe you test an anterior deltoid and you would touch the heart point or the liver point or the gallbladder point or the hiatal hernia point, etc. And if touching that point and testing a muscle caused the muscle to go weak, then he knew that that area had some damage to it. And then he devised treatments to fix that. Frequently in this system called total body modification that they formulated, frequently the treatment is done with a small handheld instrument called an activator gun. And you tap on certain points on either side of the spine to activate that spleen or that liver or that kidney or whatever it was. So Viktor Frankl was a genius, and I was fortunate to have studied with him and do his work. And now I was probably the only person who had studied Viktor's work on allergies and had also learned Patanjali's Yoga Sutras. I had been in Europe for 9 months with Maharishi Mahesh Yogi, practicing what's called siddhis. And from that knowledge, I was able to combine Dr. Frank's allergy technique with this knowledge from Patanjali's Yoga Sutras and create a system that would fix the allergies frequently, all in one visit. Or we'd correct 75 or 80% of them all in one visit. Because with Victor, he taught us you could fix 3 at a time. Now we were able to fix them all at once. And if they hold, that's the end of it. If it doesn't hold, you just figure out which 2 or 3 are not holding and you treat those just the way Victor had us treat it. So it's a big step forward in non-medicinal treatment of a whole variety of things. And so we do a lot of digestive disorders, and we do acid reflux, and we do asthma, and some of this stuff is actually pretty easy once you know the system. All right, I hope that helps explain kinesiology to you. Thanks.